Even in these challenging times, Children First remains open and continues to provide services to support children and families in our community. We ask for your patience as we ensure safe and prompt access to our resources. If you'd like to make a referral, if your family needs our services, or you simply need to speak with someone, please call a member of the Children First team at 519-250-1850.
And so the earlier we can intervene with families to support and provide strategies, recommendations, and new ways of maybe parenting, the better outcomes are for the child and the family in the long run. And so that was one of the biggest, when I came into this position, I guess the loudest feedback I heard from families is, oh my gosh, we wish we had known about your services earlier. The earlier we can intervene, the better outcomes are for children and families. Children's brains are developing, especially between birth and 3 years of age, and even up to 6 years of age. And so we really want to get those neurons firing and connecting, making those connections, and developing some really good developmental qualities and skills and strategies so that families can continue to build on these as the child grows through.
As an educator, I 100% agree with you. And you see that in the classroom, the ripple effects of kids that have been supported from early on, especially students that live with disabilities or learning challenges. If they've had supports from an early age, by the time I see them in high school, the gap is so much smaller. And so we desperately need the loving care that you provide to those young minds and the support that you give to those families. What kind of specific resources do you offer?
Well, so we do have speech language pathology, we have occupational therapy, psychology, social workers. All of our staff have a specialty in child development or children and infant mental health. And so although we have 3 streams, we really try hard so that our families don't experience 3 different streams, and that they see us just the collaboration of our disciplines and our resource consultants just working together to support families. We also run parenting groups. And so we do a circle of security parenting group is really about the attachment. And sometimes how we were taught and how our parents taught us to parent, we know that things have changed and there's new research and new evidence. And so it's rethinking some of those parenting strategies and really being present with your child. So we do an attachment-based parenting. Triple P is positive parenting strategies. Yeah. So really focusing on what the positive things that parents can do with children, especially, in those times when the child is not regulated and very upset with these big emotions. And how do you help the child, right? Understand big emotions are okay and how to sort of manage them. And then we also offer Friends Resilience, and there's a group for the parent and there's a group for the child, and they learn about anxiety and managing anxiety. We also have a contract with the Western Autism Hub, and so we are able to do autism assessments right at the front door for families. So sometimes families,
that's awesome.
They just want to know. They don't want any intervention first. Let's just look at whether or not there's a diagnosis of autism. And now we're in a position where families do not have to travel outside of Windsor, Essex. And as long as their child is between the ages of birth to 6, we can do those autism assessments for them.